Rachel Schuster, and I am one of the family medicine physicians here at Beacon Health System. I'm going to talk a little bit about strep throat, something you've probably heard quite a bit about during this winter season. It's important to note that there are a lot of different causes of a sore throat, and the majority of those causes are actually from a virus, but there are a small subset of those sore throats that are caused by a bacteria, specifically group A streptococcus, which is more commonly known as strep throat, and that's what we're going to talk about here today. So strep throat here is a bacterial infection, and this is an infection that's going to cause you to have a sore throat, some neck pain and swelling, headache, fever, and potentially as a child, some abdominal pain and vomiting then too. Children also sometimes have a red rash associated with that. That's found in the skin folds as well as the armpits. And physicians a lot of times then will say that they see some white spots on the backs of your tonsils and some swollen tonsils or redness in your throat as well too. Now, strep throat is incredibly contagious and it easily spreads from person to person just by tiny droplets during a sneeze or a cough. Symptoms usually develop within 2 to 5 days after exposure. It's most common for children between the ages of 5 and 15 to come down with strep throat, but adults can also have strep throat as well too. It's really important to see your doctor when you are concerned that you may have strep throat because antibiotics are of utmost importance. The antibiotic is going to help do a couple of things. First, it's going to help you feel better. It's going to treat the infection and help your symptoms go away. Second, it's going to reduce the risk of transmitting this infection or passing it along to your close family members and friends and coworkers. The third important reason for antibiotics is that it can help prevent the sequelae of this infection turning into something like rheumatic fever or inflammation of the kidneys. In order to test for strep throat, your doctor will do a quick swab of the back of your throat and then do what's called a rapid strep test. That usually takes about 15 minutes to get the result back. If that test is negative, but the doctor still has a high concern that you have strep throat, he or she will likely send that sample for culture, and you'll find out in about 2 days if that's positive for strep throat or not. Once that diagnosis is made, it's important to start the antibiotic. Now, the antibiotic needs to be taken for about 24 to 48 hours before you're able to return to work. And it's also important that you have not had a fever for 24 hours before you return to work or school as well too. Some other important ways to help minimize transmission include actually getting rid of that toothbrush that you were using or that your child was using a couple of days after you started your antibiotics. This is because the bacteria can actually live on the toothbrush and can actually help spread the infection from other family members' toothbrushes that are touching the infected toothbrush. So new toothbrushes for all. It's also important to wash your hands and to cover your mouth and your nose when you're coughing or sneezing. During this time, it's important not to share food utensils as this can also pass along the infection. You're on your antibiotic, but your throat still feels kind of crummy. So what else can you actually do? So supportive care includes taking medication like ibuprofen, which includes Motrin or Advil, or acetaminophen, which includes Tylenol. This can help reduce your pain and fever. It's very important to not give children under the age of 18 aspirin, as there are some serious complications that can go along with that. Things such as gargling warm salt water by taking 1/4 of a teaspoon of salt and putting that in 8 ounces of warm water may help soothe your throat, as well as softer foods or cool or warm liquids in general. It's important to drink plenty of water to help prevent dehydration as well as to lubricate your throat. And it's also important to rest. Sleep is sometimes the best medicine. So some takeaway points from this medical minute. Strep throat is here in our community. If you have symptoms consistent with strep throat or if you've been exposed to somebody with strep throat, please come and see us. We're more than happy to help you. I wish you a happy and healthy new year, and I look forward to these coming months with a little bit more sunshine in our lives.